Welcome to Neurofield Basics. My name is Dr. Nicholas Douglas, and today we're going to cover transcranial random noise stimulation and transcranial advanced pink noise stimulation. The Neurofield system is set up in such a way that you can actually deliver different forms of noise. And it's really fascinating in terms of the effectiveness of noise for stuck clinical systems, or stuck systems of where people are not responding to what I would consider just entrainment protocols or DC's protocols. So to use random noise with the DC units, you want to get into the manual control here, which I was able to get into by going, you set up you choose your patient, you get into treatment stimulation setup, and you click on this button right here. It says manual DCS, tACS. Now in here, you want to be able to choose your random noise procedure here, basically. Now we're going to be covering the use of manual control in other videos, but if I select one of these here with random noise, you can see that it'll pop up this little widget here, and you can set this accordingly and then be able to give random noise. The advanced pink noise is very unique to the Genesis system. I clicked on this here, I choose Genesis tAPNS, and it opens up this little widget. Basically what we did here was we filtered out white noise. We applied a filter that you can actually create using this widget. And again, we're going to talk about this more specifically when we get into the use of manual control. But the purpose of using white noise or pink noise is to disrupt stuck systems. So if you have a clinical system in which the person is not responding for one reason or another, you can utilize this disruptive procedure. And it's usually good to follow it with what I would call a linear protocol. So you disrupt for a period of time, and then you give a tACS protocol to entrain the brain and show it what you want it to do. So the pink noise system is, again, what I was showing you in previous videos, whenever you stimulate using cranioelectric, you're going to get surges of calcium and sodium ions. You're going to get an increase in GABA, and you're going to get a decrease in glutamate. So it's important to kind of keep that in mind when you're using this kind of modality, that the person is actually eating, that they are hydrated appropriately. I like to use the pink noise system or the random noise system as kind of like the #1 protocol on my list. We would usually run it for maybe 10 minutes and then follow it with another protocol, or 10-15 minutes. Typically my sessions don't go longer than 30 minutes. And so I might give random noise for 10-15 minutes and then give an alternating current protocol depending on the EEG, QEEG data, and then give that protocol for X amount of time. This usually yields the outcome that I'm looking for, or there's going to be no change. And that's kind of the great thing about this entire modality, is that it either works or it doesn't. And thank God there are no serious adverse side effects as a result of trying different frequencies. The brain will either accept it or it won't. If it does, then you'll see a change occur. If it doesn't, then nothing happens. So random noise, pink noise, very good for disrupting a system that's stuck, that's not responding to any other kind of treatment. All right, have a great day.